Hey guys, it's Dr. Jacqueline here with another segment of Ask Dr. Jacqueline. So, a question that I got this week is, what should I do about shin splints? Shin splints are a relatively common occurrence and it's no fun. I've had them myself. I see them a lot in youth athletes, gymnasts, your distance runners, your weekend warriors who are doing, they're kind of sedentary during the week, but then they want to do those sports on the weekends. I see them in gymnasts, soccer players, volleyball players. So it really runs a gamut and it really isn't age or gender specific. And so when people ask me, what should I do about shin splints? Number one is rest. Especially if you're starting a new activity. Your body is telling you, you got to take it easy a little bit. So listen to your body and just rest a little bit. Kind of draw back a little, a bit from what you're doing, from your activity, and rest. Give your body some rest and then transition yourself into doing more and more. Also, some people like massage. That works for some people. And I'm seeing a lot more people wearing compression garments, like little sleeves. So that can help. I don't particularly endorse a particular brand, but if it feels good, wear it, as long as it's not cutting off the circulation in your lip. And one of the main things that I tell people is check your shoes, especially the tread and the wear pattern. We can only wear shoes for a certain amount of miles. And I know we love our particular shoes, especially if we've broken them in and they feel great. But we got to check the tread on the bottom. Is it worn? Also, if you have any deforming foot factors like hammer toes or bunions, have your shoes started to change? Has this construct of the shoe changed? So just keep in mind, although we love our shoes, especially when they're broken in, we can only wear them for such a period of time, okay? And there's only so much use out of it. So we want to make sure that we're wearing the right shoe gear. And there's also orthotics. They say what makes people beautiful is the symmetry. And unfortunately, a lot of us are not symmetrical from one side to another. I've seen, identical twins come in, 2 different feet. I myself have different things going on, depending on the foot. And so sometimes we got flat foot, we've got a high arch foot, hammer toes, bunions. We may be dealing with, plantar fasciitis. There's a whole bunch of things that could go on. So we want to make sure that we're always checking, and we may need something to absorb some of that shock. We need some good shoes, we need some good orthotics, and something that's really going to help to absorb the shock, especially when we're running and doing those activities. So, and also too, if your stomach can tolerate it, and if you have no other medical conditions, there is a non-steroidal anti-inflammatory, which will help reduce the pain that is associated with it, and if there's any swelling. So, got to make sure that your stomach can tolerate it though. So, that's generally what I tell people with shin splints. And oftentimes, once you rest and you take away some of the deforming factors, it feels a lot better and you can get to doing the things that you like. We want everybody to be active, everybody to be healthy. So, we're just going to have to do what we can do in order to treat those shin splints, but usually just rest. So, if you have any other questions, let me know.